Good afternoon. I'm Dr. Sandra Martel. I'm the Public Health Administrator for Winnebago County, and I'm joined today by Mayor Thomas McNamara of the City of Rockford. So today is August 31st, which is recognized as throughout the world as International Overdose Awareness Day. The goal is to raise awareness of overdose and reduce the stigma of drug-related deaths. So while we've been talking about COVID-related deaths and what other associated, conditions are with COVID, today we're going to talk a little bit about this stigma of drug-related deaths. And our goal today is to remove that, to understand it's a medical cause, just like COVID-19 is a medical cause. Despite a global pandemic, deaths from overdose have continued both nationally and here locally. In Winnebago County in 2019, there were 130 overdose deaths. From 2020, from January through July 31st, so first 7 months, there have been 117 overdose deaths. So what can you do? Remember I said part of it is to gain awareness. So what can the public do? We can get trained to administer Narcan or naloxone, which is the life-saving drug. The training can be provided virtually or in small groups with appropriate social distancing and face coverings. While you need access to the nose of an individual who has overdosed, you can wear your face covering and mask and administer the naloxone and Narcan and sanitize your hands afterward. The time it takes to administer is less than 15 minutes. So the risk to you as a bystander assisting with a rescue is minimal. Anyone can save a life, and we need everyone to be ready to save a life. Every home should have naloxone, and every community member should be trained to administer. So for information on training, please see our website or contact 815-720-4283. We need everyone to be trained to save a life. Last week, we heard about updated testing guidelines for COVID-19. Both the Illinois Department of Public Health and the Winnebago County Health Department, along with its Northern Illinois Public Health Consortium partners, came out strongly to encourage testing for individuals with symptoms of COVID-19, individuals who had close contact with someone confirmed with COVID-19, individuals who have been referred for testing by their healthcare provider, individuals who require screening for congregate settings, including our universities that are returning, individuals who may have been exposed in a group or crowded setting or travel to an area with higher rates of infection. In short, we recommend testing of everyone. Testing of asymptomatic individuals helps us to identify infections of COVID-19 in individuals earlier to prevent community transmission. And our community has understood this from the start. All community-based testing sites in Illinois, including the sites in Winnebago County, at the University of Illinois Health Sciences campus, and the community-based testing site at Rockton Avenue, formerly Schnucks, are open to all regardless of symptoms. Individuals who test should quarantine until their results are received. And I'm often asked this question, if you're a contact to a case, will a test get you out of quarantine? You cannot test your way out of quarantine if you've been exposed to COVID-19 and have been called and asked to get tested. So I've often heard about, well, if we test more, our metrics get worse. And so again, our metrics focus both on new infections and the percent positivity in the community. So simply getting more testing doesn't increase our chances of having to implement stronger mitigation standards. Testing is not a numbers game. It is intended to prevent additional infections and especially protect our vulnerable individuals in the community. So we approach our third holiday season of the summer, which is Labor Day gatherings and celebrations. I want to remind the public as well that family gatherings are becoming another major source of transmission of COVID-19. Spikes of COVID-19 were related to Memorial Day holiday, the beginning of the summer, our July 4th celebrations throughout the states, including California, Nevada, New York, North Carolina, Utah, Texas, and others. But we have to come back and say, what were the origins of Labor Day? It's rooted in the trade union and labor movements that sought to improve the working conditions of Americans. And we've all begun to understand how important essential workers and our entire first responder workforce, our healthcare workers, and as we begin to return to our schools, our teachers and the staff that support our schools. We need to be mindful and intentional about celebrations and long weekend plans. We want to limit the number of contacts and potential exposures. Wear face coverings, maintain social distancing, and wash your hands. Nothing new, but I'm going to add a little twist one. Keep it local. We know our infection rates in this area, and we know we've been working hard to keep it low. Let's honor all the workers in our community by wearing our face coverings when we're in their presence. Let's protect them, their families, and the work that they do. If we want to continue our restoration and our rebounding, we need all of our workers healthy and able to carry on. Local numbers. Today, there were 9 new cases reported for our total case count of 4,233. As expected, at the end of last week, we turned orange based on the case rate exceeding 50 per 100,000 for the week ending August 22nd. Our case rate for Winnebago was 66 per 100,000. Our rolling positivity rate is under 5 at 4.6%, but while we're still under 5%, we've had positivity rates of 8% or higher in the last week of August. So we expect that we will be going into orange in that area as well at the end of this week. The highest infection rate continues to be among our 20 to 29-year-olds. So understand how important that group is to keeping our rates down. And when I talked about testing earlier, about the importance of everyone getting a test, approximately 22% of our population has sought out testing. Total tests performed to date in Winnebago County are over 65,000. We have no additional deaths to report, and our recovery rate is at 96%. We have no new locations of concern. But as we prepare after Labor Day to return to in-person education and hoping to support that option, we need to continue to be vigilant by wearing our face coverings when it's outside of our home, washing our hands frequently, maintaining social distancing, cleaning frequently touched surfaces, and staying home when sick. As I've said before, these are easy things to do, and we've got this. If we want to keep our infection rates low and we want to continue on our restoration and recovery process, these are the activities that we need to do.